But it's honoring the mom. It's heralding and elevating the mom and her wishes and desires, because this experience is going to be a part of her life for the rest of her life.
Welcome back, friends, to the Erie Wellness Podcast, where we explore a wide range of wellness topics, highlight the incredible local professionals right here in our community, and encourage you to advocate for your health and well-being. Today, I'm joined by Bekah Yawn, a fertility educator, hormone coach, doula, childbirth educator, and perinatal patient advocate, and fellow podcaster. For the Love of Hormones is the name of her podcast. So if you enjoyed today's conversation, make sure you go check out Bekah's podcast. Bekah helps women navigate fertility, pregnancy, birth, and postpartum. Her passion is helping women understand their bodies, advocate for themselves, and make informed decisions throughout their motherhood journey. In this episode, we're going to talk about fertility, hormone health, preparing for pregnancy, building a birth team, advocating for yourself during the whole process, and why education can be one of the most empowering tools a woman, really a family, has throughout their parenthood journey. So I know so many families in our community are going to benefit from this conversation. Welcome, Bekah.
Yay, thank you. What a fun summary. I'm so excited to be here.
I'm looking forward to today's discussion. It's kind of like a little fun icebreaker. What does an ideal summer morning look like for you, Bekah?
Oh my. Well, I love it when I just get to have a slow morning with my kids. I have 4 of them, and they're 6 and under, and not rush to things. I think that is just my favorite morning, is not rushing to anything.
You and me both. Yeah, I love quiet mornings. Take the dog for a walk, have like tea or coffee, do a big breakfast. Everyone's just kind of in their PJs till like 10, 10:30, and then get going for the day.
Yeah.
So before we jump into today's discussion, I'd love for you to share a little bit about your journey. I know your own journey really included fertility, pregnancy loss, and eventually working with a hormone coach, doula, and midwife. So how did those experiences shape the way that you're working today?
Thank you. Yeah, I never would have imagined I would be doing what I do now. But God's made it clear that He's just built me to serve in this way.
Mhm.
And unfortunately, it was through a really hard time in our lives. We had 2 boys. They were healthy, pretty straightforward pregnancies and births. But then we got pregnant again, and we had a 15-week miscarriage. And that was just absolutely devastating. It was really confusing. It was shocking. And it was just awful, and we weren't really given answers as to why. We were kind of told the classic things of, well, there was nothing that you did to have caused this, and there's no way you could know why this happened. Just kind of all those cliche empty things where it was like, oh my gosh, this sucks, and I do want to know why. Like, I do want to know if there was a reason. I know there might not have been, but I want to know why. And in addition to that, our doctor may have told us, like, hey, it's probably a good idea to wait a little bit before you get pregnant again. But we weren't given any tools for how to do that, practically speaking. A big part of my fertility story is I was on hormonal birth control for over 14 years, from the time I was like a kid until the first few years into our marriage. And
Mhm.
I didn't know how much that impacted my body and how it impacted my thyroid and my gut and all of these things. And eventually that also became this intuition of, you know what, when I'm dealing with this loss, I don't think I should get back on birth control. I wasn't educated or aware of what that would have done to my hormones on top of what they were already going through, but I had enough of an intuition to know it wasn't the right thing. And we got pregnant again, and we lost that baby. And then we got pregnant again, and we lost that baby. So by after the third loss, my husband and I were just crushed. And I knew I couldn't go through that again. And so part of our story, I say, is we went to our Catholic friends and we were like, okay, we know you guys are doing some kind of weird stuff to somehow space out your kids and you're not using birth control. So what are you doing? And they
Mhm.
were so sweet and they shared with us about natural family planning and fertility awareness methods. And I thought it was the weirdest woo woo thing on the planet. But I went and did my own research and I studied some of the books that they shared with me. And I was like, holy cow, this has a lot of science and evidence to it. And my husband and I learned a fertility awareness method, and we applied that for so that we could avoid getting pregnant, so that we could figure out what was going on with my body. Why did I keep losing these babies? So that was a huge part of my healing journey. Number one was learning a fertility awareness method. And also in that time, I found myself something called a hormone coach. And she was just absolutely amazing. She helped me with the little things in my day to day that I didn't realize made such a big difference in how I was feeling emotionally. And those emotions that I was feeling was really connected to my hormone story and the healing that needed to happen. So, with all of those things, we kind of figured out what my root issues were. We took a time of about 6 months until I felt confident with my cycle charts and just prayer that it was a good time to get pregnant again. And
Mhm.
so we got pregnant with our rainbow baby, and she was such a blessing. That was the most beautiful pregnancy. And I had this desire and intuition that, you know what, I think I want to have a natural birth this time. I want to do things the way that, our bodies are designed to do them. And I don't want to do all the medication and the epidural like with my first births. And that's really what I want to do. And it was a drive when I was 30 weeks pregnant from Erie to Colorado Springs down the 25 that led me to think, you know what? I am so darn uncomfortable right now just being 30 weeks pregnant. There is no way I am going to make it on a drive to the 25 to a hospital when I'm in labor. There's just no way. So I had that intuition, and that intuition was so correct because I would have had my baby in the car had we planned that hospital birth. We ended up switching care to a home birth local here. Her name's Renelle Williams, and my doula is Bethany Melton. She's now a midwife as well. And it was the like 8 weeks of care that I got with them was so life changing. That's what pressed me to become a doula after that birth experience, and just the midwifery care compared to the OB care was so different, and it just changed my life. So
Mhm.
now I get to help support people in getting pregnant in their journeys. And then I've been able to have a few local clients supporting them with getting pregnant, and then even getting to serve them at their birth as a doula. And it's truly the most rewarding thing. I feel like I just feel so humbled and honored to get to serve in this way. So that's a piece of my story, and I'm just thankful to be able to come on here and share.
Well, thank you for sharing your story and being vulnerable. And, I'm sure that there was a lot of times throughout that whole entire process where you just felt at loss and didn't know what to do. But now look at you. You have another baby. So now you have four, right?
Yes, that's right. Yep, we got pregnant again, about a year and a half ago, and it's a whole other thing, and I love sharing this story, and especially with my clients as a doula of, I share like, "Hey, I had 2 hospital births, they were medicated, I had 1 super fast home birth, and then I had a pregnancy that turned me inside out, upside down." It was so difficult, and the birth was so difficult. It was a 3-day labor, and not just 3 days labor, like, it was the most intense, kind of honestly very excruciating pain I'd ever been through, and by the grace of God, I got through it. We did have her at home. We had to do some things to, like, get it going, otherwise, I was like, "We're gonna have to go to the hospital, I'm gonna have a C-section because I can't do this anymore."
Mhm.
But I did it, and it's something I bring into my story for my clients of like, we can control and we can plan and we can do all the things that we know to do. And at the end of the day, we just have to have open hands because we truly don't have control over it all. Right. And so
Mhm.
we have to be willing to go wherever we need to go, and
Mhm.
be flexible with that.
Great. Well, so great though that you were able to kind of have those different experiences. That way, when you have your families, you can provide these unique perspectives and kind of be able to cover a wide range of the spectrum. Obviously, every
Yeah,
birth is a little bit different, but
right.
just, you're like, that third one was so easy, got me really confident. And then that fourth one just took us through a loop.
Oh, yeah, for sure. It's definitely helped me to be extremely empathetic towards my moms. Not that I wasn't before, but, like, I'm like, "Yeah, I really get it when it's really, really hard," you know? So,
So let's kind of start from the beginning. So you talk about conception health and helping women prepare for pregnancy. So when should women or families, I should say, in general, start preparing their body for trying to conceive, and how can they support their fertility during that season?
yeah. So, I will share what I wish I would have known before I got pregnant.
Hmm.
Um some like I said, the birth control thing was a part of my journey. So I like to say this to everyone. If you are on hormonal birth control or an IUD or anything, you really, really want to give yourself time getting off of that before you get pregnant. There are research studies. Dr. Jolene Brighton has published them in her book, Beyond the Pill. And there's research that supports that the fetal immune system is impacted in a negative way with mothers who have been recently on the pill or on some form of birth control. And I definitely saw that in my firstborn. We got off birth control and got pregnant within about 3 months, and his immune system sucked for 5 years. Like, it
Hmm.
was awful. Like, he was the kid who would just always be sick. And I relate it back to, well, I didn't do anything after having been on birth control for so long and got pregnant with him immediately. So that's something I wish I would have been told before getting pregnant is if you've been on that, you are actually considered in something called post-birth control syndrome for a whole year. So I'm not saying to like wait a year, but I am saying get off of it. And there are things you should be doing to detox your body, to check your thyroid, to make sure you're replenishing your body with nutrients. I mean, I would say like a minimum of 3 to 6 months after getting off of it up to a year before conceiving and making some of those lifestyle changes with what we're eating, how we're drinking, how we're moving our bodies, just our general lifestyle pace
Hmm.
and how that stress affects our body or not. All of those things really has a huge impact on our fertility health. The fertility is the fruit of what's going on in the insides of our body.
No, that's a great perspective because you might be able to conceive right away after getting off the pill, but that doesn't mean that your body is actually ready for it and in its prime to be able to carry and have a baby. And
Yeah, that's a great way to recap that. And it's just wisdom. Unfortunately, if you're hearing this, it's like, well, now you know.
I
So it's one
know.
thing if you don't know and there's nothing you could have done about it, like you can't fix the past. But now, if you know this information, you are responsible for doing something with it.
Hmm. I know. So you are a hormone coach, correct?
Yes. Yeah, so I do lots of advocacy work with that as well. So advocacy is it's just one of the things I do. So I do advocacy for what labs to ask for your doctor to run. So whether your
Okay.
doctor is like more conventional or more restorative, I will work with you on like what kind of labs to get done, and it's all based off of your symptoms. And even when it comes to hormones, oftentimes we don't need to do labs because your charts tell us what your body is dealing with. So sometimes the blood work is nice to have as a confirmation, but usually we just need to look at your charts and we could tell, oh, yep, you're probably dealing with high estrogen, low progesterone, or low overall. And we can confirm that with blood work, or we can even bring in some urinary at home tests. That's a lot cheaper and easier to do to help confirm as well.
Hmm. What do you mean by charts? Can you describe that?
Yeah, so your cycle chart, when I know I said words like your ovulation cycle chart. I say that to say because our society has this perspective of, track your cycle means track the dates of your period. That is not tracking your cycle. When you learn through one of those fertility awareness methods how to actually track your cycle, it's tracking from day 1 of your period until the last day of your cycle before you get your next period, whether that's like 24 to 36 days or if it's longer or if it's shorter. That is we call it your ovulation cycle because your ovulation is the main event. And
Hmm.
when you're tracking these things, it's learning how to track your period more accurately. learning how to objectively know, is this a light, moderate, or heavy day? Is this a spotting day based off of how much blood flow we're having going on? Is it brown bleeding? Is it red bleeding? Is it weird and confusing? When are you having that cervical mucus? How does that cervical mucus change? And when do you have periods of being dry? In your perineum, like all those things, those are your biomarkers. We can add in basal body temperature. There's different things that you can add in to get more and more data and information as to what's going on in your chart, which is what I explained it was. And that just tells us so much information about what's going on in your body.
Okay. Thank you for explaining that, because I just wanted to know the difference between the two.
Yeah.
So I know that many women can feel confused, overwhelmed when trying to conceive. So how do you know when it might be time to dig deeper into your fertility? And what are some of the biggest misconceptions you see women carrying into that journey? So say you've been trying for a couple of months, but you're not getting pregnant. When do you start wanting to look at that route?
Yeah. Well, first, I want to address just in what conventional medicine says about trying to conceive. They will not really do anything until you've been trying to get pregnant for a year. And they say, oh, it's no big deal, try for a year and then come back to us if you haven't gotten pregnant. And then what happens at that appointment is they say, not sure. Let me send you on to the fertility clinic. And the fertility clinic, if it's just a standard general fertility clinic, they typically just go straight towards medications, trying to force your body to ovulate, force your body to get pregnant. And they most often do not address the roots of why is she not getting pregnant? Like what's going on with her ovulation? What's going on in her luteal phase? Um, Other things that some doctors will do that are not helpful is testing your hormones, but they don't test your hormones timed with your ovulation cycle. So if you test your hormones just on cycle day 3 or just really any time in your cycle, it's not going to give you an accurate picture as to what your hormones are doing. I say that I don't know what the correct number is, but I say I'm like, there are 3% of doctors who are actually amazing and wonderful and incredible, and they get the fertility cycle. They have additional training from medical school that they have taken to understand fertility and hormones and ovulation and all the ups and downs and even root causes and nutrition. But in standard medical school, these things really aren't addressed. They're barely touched on of, oh, fertility awareness methods, they're there, but they're not reliable, they're not effective. And that the education is old. They're talking about the rhythm method, which is not reliable and it's not an effective way to avoid pregnancy or understand your body. And it's 100-year-old data. And we have data that has come out within the last 50 years that is much more recent, it's up to date, but it's not in the medical school education yet. So if your doctor hasn't taken that, it's not that they don't care or they're not good, it's just that they haven't had that education. And so that's really important in this trying to conceive journey because they might not be the person to help you figure out what's going on. So first, I just had to address that part, like the whole waiting a year thing. And well, we could test some of these things, but everything looks normal. I'm like, oh, that's actually not serving us. That's not giving us any answers. So let me briefly talk about how does conception occur? Because when I was going through my losses, I couldn't even explain to you how ovulation worked. So the basics of getting pregnant is when to get pregnant, you need a healthy egg from the woman, you need a good sperm from the man, and you need good, healthy cervical mucus from the woman. Those are the 3 keys to getting pregnant. And if one of those things is not happening, or it doesn't have a good quality, or it's off, pregnancy will not occur. But when we have all of these things, pregnancy happens and pregnancy occurs. We get the egg from ovulating, the cervical mucus comes along with ovulation, and the sperm comes from the man. And it's a simple, natural, physiological thing that happens in a woman's cycle when she's healthy to ovulate every single cycle. So if intercourse is timed with when the woman has cervical mucus and sperm lives in that cervical mucus, you should get pregnant that cycle. Sperm can live in cervical mucus for 5 days. So even if you haven't ovulated yet and a couple has intercourse, a couple days before ovulation or so, It's really
Mhm.
incredible. You should only have to time intercourse for when you're fertile, when you're having that cervical mucus, which you can learn more about that inside of one of those fertility awareness methods. I teach one. And there's several different methods you can learn, but learning when you're fertile and when you're not fertile, that's when you time intercourse. I've heard of clients having been given advice from doctors to have sex every day in their cycle or every other day in their cycle from fertility clinics. And it's absolutely ridiculous because a woman is only fertile in her fertile window of her cycle when she's having that cervical mucus, when her body is approaching ovulation, and that is when to time intercourse. Honestly, sometimes just that education and a woman understanding what her body is doing is enough for the couples to learn how to accurately time intercourse. That's enough for them to get pregnant. A lot
Mhm.
of the times, if there is a root issue going on, either with the woman or the man, that does need to be addressed. So I'm going to pause there because I'm just like going. So, any thoughts or questions so far on that?
No, I think that that's really important. And if it's as simple as that to be able to help families, be able to have a starting spot, then that's amazing. And then I was also thinking too, in the process of, what conventional medicine says is to, wait a full year. It's like that's a long time of just waiting, especially if you have no education on what you're doing. You're kind of wasting your time for a full year if you don't really know all of the basics and have a foundational knowledge of what it takes to be able to conceive.
Absolutely. Yeah. I mean, we could at least be left with, well, wait a year and make sure you're applying intercourse correctly with a fertility awareness method. At
Mhm.
least that,
Mhm.
would be a little bit more helpful than nothing. And
Right.
not only that, the method that I teach is called FEMM, FEMM. It stands for Fertility Education and Medical Management. And I do the fertility education side, and we have medical doctors who are also trained in this fertility thing. They're called FEM medical management. And so their job is to kind of help take women's data from their ovulation cycle charts and apply, okay, well, it looks like we're having some deficiencies in your ovulatory phase or in your luteal phase or overall in your follicular phase. And so here are the things that we could do from a medicinal side to help restore your body. What I do as a hormone coach is I don't do the medicinal part of things because I believe that we have so many gifts on this earth to help restore our body naturally. And half the time when I work with clients, that's all that they need. They just need a change legitimately in their diets or change in how they're drinking and how they're sleeping. And, maybe we're going to use some herbs or essential oils or supplements. Sometimes we don't need to do that. And sometimes we just need to change how we're exercising based off of what our hormones are doing. And sometimes just those simple changes is enough. A lot of times we don't have to go to medicine to repair our bodies or to override our bodies. There
Mhm.
is a time and a place for it. So I'm not like anti-medicine at all, but I'm also like, let's make sure that we do all the foundational things that is available to us and that we should be doing, whether we involve medicine into our journeys or not.
Mhm. Maybe you've run into a family, they've tried to conceive for a year, it has not worked. Now they're dealing with a fertility clinic, but maybe they also have someone on board that's giving them some other natural alternatives like you talked about, but these are the basics. So what happens if those don't work? What do we do from there kind of thing?
So this couple is hopefully they've learned how to chart through fertility awareness method because their chart gives us so much information about what's going on in their bodies and what needs support. And then also hopefully they've learned the foundational hormonal lifestyle things that they should be doing to support their bodies, figuring out what is their root issue. These are all things that I help and support with. Are they dealing with gut issues or thyroid or liver or inflammation or adrenal issues? All of these things have a huge impact. So we must make sure that the couple has figured that out. Like, have they identified these are the root things? And what are they going to do about it? How are they going to work on it naturally? Because medicine isn't going to fix it. Caveat, except for the thyroid. Sometimes we gotta have some thyroid medication.
Mhm.
But for your adrenals, like, girl, that's all lifestyle. That's all lifestyle to heal those. And those are just some examples. So that my point to answer your question is let's make sure they've learned the charting, learned the foundational hormonal support. And when I work with couples, if that's all that we're dealing with and we're able to work on that, they usually get pregnant within 3 to 6 months. If that's not happening, then it's like, okay, you know what? Maybe there's something deeper medicinally going on. We need to bring in a restorative medical practitioner onto your support team to aid in this pregnancy journey of getting pregnant. And I have a whole host of referral providers that I like to loop in onto the team. Just as, we're going to be talking about with a doula and having an extra person in your team. I'm like, it takes a village to bring a baby into this world. It takes a village to raise a child. Sometimes it takes a village to get pregnant, and that is okay if that's part of your story. And having that humility to bring on someone like a hormone coach and a restorative medical practitioner and your acupuncturist and your chiropractor, like sometimes it just takes that village, and that's okay. So that is kind of what I would go to. And honestly, when we get to things like IUI or IVF, there can definitely be a time and a place for it. I've had several recent podcast episodes on that if you want to hear more of my opinion on those things. But we have to make sure, like, have we done the foundational restorative root cause work? Because if we jump straight to IUI or IVF before your body is ready, it's not going to fix whatever roots were going on that were impacting this difficulty in conceiving journey for you.
Well, thank you, yeah, for kind of just explaining that second part and what it does take. It might take a village, and every family's story is different. So a lot of people have heard the word doula, but may not fully understand what a doula actually does. So what does a doula provide that a doctor or OBGYN typically doesn't? And why do some families feel like one of the best investments that they've made during their pregnancy?
Right. So a doula is somebody who helps prepare the couple for birth in their pregnancy. One of my favorite things about working with clients is working with them a little bit earlier. That way we have that time to become as educated as we can because there's so much to learn just about being pregnant and about birth. It's like the wildest thing on the planet, I think. So there's
Mhm.
so much to learn about it. So a doula should really help with that preparation process and that education process to prepare parents for what is a normal birth, what's not normal, what are the things that could come up. So they're definitely there for the educational portion of things, and they're also there for the birth, right? So in the birth experience, doulas are not made to replace dads. I know that's kind of like a misconception of, well, my husband and I, we got this. My husband is my doula. No, your husband is not your doula. Your husband is going to be your rock. He's going to be your knight in shining armor. He is going to be the one that you cling to and that you must have with you, or your partner, like whoever is with you. Like the doula is there or should be there. This is how I operate to help your partner look like just be the best person to you in that experience. I like to do little things like, hey, Sam, can you take that phone call outside of the room?
Mhm.
Or helping him to know, like, hey, if you squeeze her hips this way, like, oh my gosh, she's just gonna love you even more. Or hey, like, doctor just came in, or maybe you should take this conversation outside in the hallway, and you can answer all the questions for her and just let her keep laboring because laboring is really hard. Anyone who's been through it is like, it takes all of you. We say your brain goes to your bottom because like you can think and you know what you want, but sometimes it takes so much out of us to be able to say what we want because we're just so physically involved in having this baby, and it's such a huge thing. So that's one of the things that doulas should do is they should just help support the dad and just be another very vital person on the team to make
Mhm.
dad, to elevate dad, to support mom in such a better way. And then how I operate as a doula, not all doulas do this, but I do love to do advocacy work. So most of that is done prenatally. So when I talk about advocacy, it really just comes down to empowering parents to learn about their options, to learn how to talk with care providers in a respectful and collaborative way, to learn how to talk with care providers in a way that it's more of a partnership rather than listening to the care provider's word as law, but actually recognizing that the mom is the one in charge and she actually gets the choice and she gets to choose what she wants to do. So doing a lot of that education beforehand is good. And then helping them build a birth plan. Most doulas should help you build a birth plan. In my practice, we do a birth plan A, and most of my clients who come to me, they want a natural physiological birth. And most of them get that. And sometimes we don't. We don't have control over everything. And so we do make contingency plans, in the case oh my gosh, you're in labor and you just got diagnosed with preeclampsia, even though you were totally healthy before all of this. So, how are we going to navigate that? And,
Mhm.
oh, well, this actually looks a lot like the induction plan that we'd put together for the weirdo chance that you're in this situation. So, let's pull this out. I've had that happen before with a client. And we also make a cesarean plan just in case. Most of the moms that come to me are like, I don't want this. I'm like, okay, yes. And 1% to 2% chance this happens. I want you to just go there, open up the window and look inside the room and see what would you want that experience to look like. Do the research, do the education, write up the plan, and then close that door and we throw it in your birth bag and we don't think about it unless the super low chance you were to need it. But that
Mhm.
really helps reduce a lot of anxiety. And then that in and of itself is a part of advocacy. So then when we're in the birth room, I always keep my clients' birth plans in my back pocket and I pull them out because even for me as their doula who reads the birth plans like 10, 15, 20 times and I try to memorize them, I'm going to get a little foggy and forget details if we've been up for 24 hours. and
Mhm.
so
Mhm.
I'll pull it out and be like, oh, actually, this is one of her values. And this is something that she really didn't want. And so I do, facilitate respectful conversations among everyone in that room. So that way, the doctor or midwife feels like they get to give their input. I give my input. So then the client feels like, oh, cool. Like we got to have my doula's input and we got to hear our midwife or doctor's input. And just everybody feels heard. And so that's
Mhm.
what a doula should do is help to facilitate respectful conversations. And then it's the mom's choice. It's the mom's
Mhm.
choice what she gets to do because she's in charge. Legally,
Mhm.
she is literally in charge.
Mhm.
Um, so let's see here. The doula should also bring physical comfort measures. So maybe some massage. I bring my essential oil kit. It's crazy, what aromas can do for a woman in labor. It's like the most magical thing.
Mhm.
Um, and whatever else is important to the parents. So, my faith is important to me. Sometimes I have Christian couples come in and they want me to read scripture over them or pray over them, or they're playing, some worship music or something like that. Giving birth is a really spiritual experience. And so just elevating that faith element is a really big deal. So whatever is important to that couple is important in that birth room. So
Mhm.
doulas also can help with breastfeeding and just helping that get established. And they also should help with some newborn education and newborn support. It's amazing becoming a first time parent and being like, what in the world? How am I supposed to keep this little amazing gift alive? And so doulas can help with that a little bit as well. So that's what a birth doula does. There's also postpartum doulas, but I'll just kind of leave that at that for now.
We're going to take a quick break from today's episode to hear a word from one of our sponsors. Additional support for today's episode comes from Bridge Refill Market, Erie's local refill shop, helping families reduce waste one refill at a time. As of May 2026, the community has helped save over 28,440 containers from the landfill through refills at the shop, from laundry detergent and dish soap to organic bulk foods and personal care products. You can bring your own containers and refill only what you need. Learn more at bridgerefill.com. Now let's get back to today's conversation. So really just going through with the parents as to like how these different things can play out, because I know so many families, it's like it didn't play out in your head, especially when you're a first time parent, how you thought it was probably was going to. So
Amen.
important.
Yeah, hits you like a truck, y'all, when you get those contractions. Just depending,
Yeah.
on the situation. Yeah.
Yeah, and too, I give sympathy to the partner or parent or dad or whoever is helping the mom with it because they're really emotionally involved in the whole process too. So for them to remember all the little details as to how they can support the woman, giving birth, that's a lot on them. So to be able to have that little bit of encouragement, reminding them, so that they can really be their best selves during that whole entire process is huge too.
Right. What I love to say is the doula, when a couple hires them, they are my clients. Like they are hiring me, they are paying me professionally, and I am obligated to them. I am obligated to my mom's right to choose. That is my job, is to elevate her right to choose. And it is not my job to make medical decisions for her. Whereas when we think about the doctors and even the midwives coming in, their job is the medical safety of mom and baby. Their job is the legal repercussions of following state policies or hospital policies and regulations. Their job is to honor the mom's choice. But sometimes that is kind of seen as a background thing for them. So it is
Mhm.
really helpful to have another party on this team who is, objective, like, hey, I'm not legally obligated to any policies or procedures here. I am here to elevate mom's choice and make sure she understands all of her options and that she gets to choose. And it's really helpful to just, part of the doula's role is to slow things down. You know, without a doula or a birth professional there, oftentimes scenarios can just get really out of hand really fast when it really isn't an emergency, but it can feel like an emergency to the mom and dad because they don't know what's going on. Like they're new to this. And so they totally trust the medical providers. Um, and it's just helpful for a doula or an advocate to be there to help slow things down, help us understand, is this a true emergency? Is mom going downhill right now? Is baby going downhill right now? No, mom is actually okay right now. Baby's okay right now. So we have some time to slow down the room and to let mom and dad stop and think and pray or talk about what they want to do, what's important to them.
Mhm.
90% of the time it's not an emergency and we can slow things down. We can give the parents time to process. And it just brings in a different vibe and a different feel, especially in a hospital setting. Um, because it's usually just pretty fast paced there and they're like, oh well, this is just what it is, and they're so used, the doctors and the nurses are so used to birth. This is what they're doing every day, all day long, and they know everything, or they know so much because they see this all the time. But especially as families who, well, gosh, this is only our first time dealing with this, or this is our second or our third or fourth. Like,
Mhm.
this is a lot for us to learn and take into account and process. And so having someone there who, is objective is a great idea.
Mhm. If you could give a little, like, tiny little lesson on patient advocacy, what would you say to the families?
So, the biggest part of patient advocacy is preparation and communication with your care providers. The other part that I train my dads on is, especially when we're in a hospital setting. I also do birth center birth and home birth. So, those are different scenarios, but this is for especially in a hospital setting. I train the dads to, hey, when the nurse comes in or the midwife or doctor comes in, after they've done their questions, just ask them to step outside and go over the birth plan with them and read it out loud, line by line. And, it sounds a little ballsy, and it is,
Mhm.
but it's honoring the mom. It's heralding and elevating the mom and her wishes and desires, because this experience is going to be a part of her life for the rest of her life. But this experience for the nurse or for the doctor is just another birth. It's just
Mhm.
another day at the hospital.
Right.
And so we really want to let the mom be heard and elevated in such a beautiful way, and let the dad kind of, like I said, be that guardian of the birth room. So right away, when my dads do that, the medical staff gets the vibes, oh, this couple has done their homework, they have done their research, they know what they want, and they're thankful for our care. They're thankful to be here, and they're willing and they want to communicate with us and cooperate with us. So it's not like an us against them thing.
Mhm.
It's definitely a very collaborative thing and honoring the mom.
Mhm. I love that. It's kinda like having someone on a go-to point of your wedding day. Like, this is a big day. It's something you plan for. It's something so many families have dreamt about, and, you don't wanna be answering all these little details. You really wanna be in the moment, focused on what you wanna focus on, and soaking it in as best you can, because it's a
Yeah.
special day. And, as a mom myself, sometimes, on my kids' birthdays, it's like, that's a I have a really, um emotional component to that day too, because it's like you're remembering what happened that day for the rest of your life. So,
Absolutely. Yeah.
so we're going to answer one listener question for today's podcast episode. Let me pull it up. Okay, so the question was, what are the biggest things you wish every new parent understood about the postpartum period, before they are in it, especially in those first days and weeks when everything feels like a blur.
Yeah. Postpartum is it's such a wild ride. It's such a wild, sleepy, exhausted, joyful, snuggly ride, and sometimes really emotional, just depending on how your birth experience was. The biggest things I would say, and I love preparing my clients on this. I actually have another course out called Pregnancy Framework. And so we have like a whole module on what to expect postpartum in your first 2 weeks, up to the next 6 weeks, up to the first 6 months, and then the first couple of years. Cause like you're literally considered postpartum for 2 years. And
Mm.
that's really incredible to fathom, but that's just how our bodies recover after giving birth, whether we're breastfeeding or not.
Mhm.
So the preparation for postpartum is really, really important. In my earlier days as a doula, I didn't really pay as much attention to it or prepare my parents for it, because we just focused so much on the birth. And that was one of my mistakes after my third baby. Like I focused so much on the birth that I did not even think about postpartum. And it was a really different experience giving birth at home and then having my all of a sudden we had 3 little kids in our house, and like
Mhm.
I'd just given birth, and it was very overwhelming and I hadn't planned very well for it. For my fourth baby, yes, the pregnancy was incredibly hard. The birth was incredibly hard, but I had an intuition I am going to need help in this postpartum. So I hired myself a postpartum doula. It was the best decision I'd ever made. You might not need that every postpartum, but again, like your intuition, it's always right. So just check
Mhm.
in and think, what kind of support, what kind of help am I going to need? And lovingly preparing to set that up. One of my favorite books is called The First 40 Days. And that book is awesome. It talks about the first 40 days of being postpartum and how should we eat? How should we rest? What should we do? What should we not do? How do we have people come in or not come in? So that's an excellent book that I highly recommend, that goes even more into that. But in full, to answer the question, take some time to prepare for postpartum in the same way that you prepare for birth.
Mhm. So, for someone who's listening who wants support with either conception health, pregnancy, childbirth education, or doula services, how can people connect with you and learn more about your programs and the community that you were building? And I love that you're here locally for us.
Yes, it's so fun to be here. I love Erie.
Mhm.
So the easiest way to get in touch is go to bekahyawn.com. Pretty simple and straightforward. Like I love meeting at Christo's Coffee. It's one of my favorite places. So
Mhm.
that's a great place to set up a consult. We can hang out and talk. And I do also have an advocacy class coming up that's available to anyone and everyone who's expecting and feeling a little bit nervous about how their birth experience might go. It's called Peaceful Powerful Birth Advocacy class, and it's a 3 to 4 hour class. It's going to be Saturday, August 22nd. Again, you can just go onto my website, onto the doula page, and you can sign up for that.
Mhm.
That'll be a great way to meet in person and gain incredible tools for how to have these respectful conversations, open conversations with holding to your values and what you want, and hearing from your medical provider's perspective as well. And ultimately the choice is up to yours. So we role play, we get the education, and you just get those really amazing skills that could literally change the trajectory of your birth outcomes. So I invite you to that class. It'd be wonderful to have you there.
Bekah, thank you so much for sharing your wisdom, your story, and your passion with our community. I know this conversation will encourage a lot of our families here that we have. If you enjoyed today's conversation and you want more of Bekah, make sure you either go check out her website or her podcast. And thank you for listening to the Erie Wellness Podcast. We'll see you again next time. All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time.